diagnose several curative STI and RTI. That is most important point you have to realize, and be a clinician and be a expert doctor. Diagnosis and treatment of common RTI and STI during client first visit. I want to emphasize you again and again in my session that don't miss that patient. They come afterwards after the investigation, because majority of these patients may come, may not come to you. And that is why during their first visit, you have to effectively treat by syndromic approach. What that is, I'll take you later on. The definition of RTI is very simple. Any reproductive tract infection, we call it as RTI. But if it is transmitted through sex, bacterial, viral, protozoal, whatever is there, we call it as STI. Now, you have to understand the magnitude of the disease globally. Imagine more than 374 million new cases are curative or of curative STI every year in the world. So huge load is there. But it is unfortunate to say that almost 75 to 85% patients of RTI STI are in developing countries like us. So it is very important that it is a challenge to all of us. In Indian perspective, if we talk, more than 6% prevalence in Indian population, and 30 to 35 million patients, new patients are seen in India. And for gynecologists is a most challenging situation that if you consider if you know the data, because Dr. Jharia is with me and he will confirm it, that male and female, how many patients come to you? 3:1 ratio is there. Least female patients, they come for STI treatment. Factors contributing to RTI, STI, you know very well, but most important is basically human behavior, lack of access to the healthcare, awareness about the RTI, STI, migrating population. Now, majority of our youth is migrating. So it is very important. Healthcare providers are not adequately trained. Poor medical services, because if you are in a primary center, then the facilities are very limited. Hygiene and environmental factors and hormonal. So these are the contributing factors, and you can see all these pictures nearby to you as pub or any other places. The same thing is there, and it is a challenging situation, and we have to worry about it. Now, common RTI and STI in male or female, there are series of diseases, infections we come across in our routine practice. RTI STI case management includes correctly clinically diagnose and treat the symptomatic patients. If the patient is having a symptoms, you have to correctly diagnose, and by proper history taking, complete history taking, and medical examination. I want to emphasize you here, most of the STI patients and the RTI, they come to us, they never expose their body. How many of you expose their body totally? How many of you examine the private parts, even anal region and the oral cavity? I think 90% ignore the oral cavity as well as anal region, but they have to be examined thoroughly. Provide patient education. Very important part of our management is to educate the patient, and partner management also. Don't treat only that patient, but the partner has to be effectively treated and prevent the reinfections. Now, this is a basic pattern we have to follow: correctly diagnose and treat symptomatic patient, education, and prevent reinfection. These are all the things we have to consider very seriously. Steps in syndromic management of a case: history taking, clinical examination, laboratory tests. Yes, they are definitely useful, but don't rely on lab tests, or don't wait for the lab test to come for confirmation and you don't ignore that patient. Diagnosis, treatment, Advise and counsel the patient and call for the follow-ups. The steps of syndromic approach, detailed clinical history is required, detailed clinical examination in a bright light with a full privacy. If any male doctor is observing, then female staff must be there in that chamber. Diagnosis, make a diagnosis, prescribe the standardized simple treatment during his first visit. That is important. Advise counseling and follow up. Why syndromic approach is better? Initially, I was thinking that the people, those who are teachers, they are making us quacks. But later on, I realized they want to make us really a clinician. These days, what is happening? We go for investigation and then treat accordingly. But here, really, you are a clinician. You are a real doctor. Simple treatment at first visit, treatment for all causative organisms, standardized at all levels. If you are in a primary center where there is least facilities, to a tertiary care where you get all sophisticated tests can be done. You can use this practice anywhere. Patient education and integral part of RTI and STI. Mind well. This is very important. You have to educate the patient accordingly. Syndromic management specific relevance to RTI STI. In this, STI clients invariably hesitate to approach the doctors. They feel that I don't want to go to my family doctor or any person who is absolutely unknown. I want to show him. Or he will go to a medical store, take few medicine, he will feel comfortable and he becomes a resistant case. That is worst part. First visit may be his last visit. We have to understand. And if we miss to diagnose here in first visit and treat, there is a strong possibility that there is 8 to 9% high prevalence of HIV spread to these patients. Dealing with one STI case, you are having an opportunity to treat one more case or maybe much more. It is a public health problem and not to be one individual. Syndromic approach, diagnosis based on the identification of the syndromes. I'll tell you in details about it. The recommended treatment are effective for all curative STI in this syndromic management. Provide single dose therapy as far as possible and comprehensive because patients may take or may not take. That is a part. If they feel they're comfortable in a one dose, then they will leave the drugs. Comprehensive to include patient education and counseling. Advantages, yes. Syndromic approach is the most advantageous because it is fast. You are diagnosing at the first visit. Highly effective. It is a well-proved scientific treatment. All possible STI causing signs and symptoms are treated at once. Scientifically tested in many parts of the world. It's not India, but abroad also it is approved. Easy for health workers to learn and practice for patients. So health can be used for providers at all primary to tertiary layer. I told you about that. But it has pros and cons are always there. Sometimes these are failures because in asymptomatic patient, if he has taken some drug, or in females, mind well, female is dedicated to her husband, agree. And if she gets any problem, she cannot think of that I am suffering from STI because she has a relation with husband only. But if husband has made a relation with some other people who is infected, he is going to infect his wife and she will never give you a proper history that she has an exposure. Over-treatment sometimes is there. Financial cost of over-treatment is also we have to consider. Increases potential for creation of antibiotic resistance in these cases, especially if full course is not provided. Not effective in some cases of vaginal lesions also. These are the different RTI, STI syndrome. I'll take simultaneous. In males, we are not considered, but yes, definitely, if you are a male doctor, male gynecologist, male person may come to you, and you should be knowing this. So I'll skip these slides, but in female, I'll consider very seriously about it. Identify appropriate syndrome management flow charts. Case clinical history. Look for the symptoms and signs of the patient. Recognize the syndrome. What syndrome is there in your case? And decide the flow chart to pick up for further actions. Male discharge, I'm skipping. I'll go straightway to female part. Vaginal discharge syndrome. Usually there is a common complaint, डॉक्टर साहब सफेद पानी की शिकायत है, burning है, and all these things are going on. So this is called as vaginal discharge syndrome. Now we have to understand what are the discharge syndrome. Sometimes inguinal bubo, sometimes you examine the patient and you find a lymph node in the inguinal region. And that is the important point we have to understand. नहीं दिख रहा. Hello. So now we have to understand inguinal bubo means any lymph node. If you are seeing, then what are the possible causes of such type of bubo? Organisms are lymphogranuloma venereum, chancroids, chlamydia. These are the main causative factors. History of positive contact is there. Inguinal region swelling is there. Sometimes you may be able to demonstrate the genital ulcers and discharge. Important point here is the fluctuation in the lymph node is very significant. Edema may be there. Sometimes this lymph node may rupture and make a sinus, discharging sinus. Ulcer discharging sinus are very common. Now, what are the investigations you can think of? Mainly this is clinical, but sometimes if you are in a tertiary care and a good place, you can go for nucleic acid testing, PCR, culture, and others. But you have to make here differential diagnosis also. Is that tubercular lesion or filarial lesion or malignancy? But malignancy are hard lymph nodes. Here, fluctuations will not be there. Now, the treatment here is very important to understand that long-term treatment has to be given till it gets subsided. Doxycycline is very good drug. In this case, to be given for 21 days. Azithromycin is also effective. Ciprofloxacin is also effective. And in this, I want to warn, never send to a pathologist for FNAC if you are suspecting inguinal bubo, because it is going to cause sinus, okay, and partner treatment. Flow charts in genital ulcer. This is a very, very common situation you come across in your practice. Organisms are several, maybe treponema, maybe hemophilus, chlamydia, herpes, klebsiella, and all these things. But here, history is very important. Exposure history is there. Ulcer and burning, they are very common complaints. Now, if you examine the patient, here you can able to see either ulcer or vesicles in the private parts. Maybe single, maybe multiple, and maybe having lymphadenopathy. Here is a very significant diagnostic differentiation. If these ulcers are painful, they are herpes infection. If they are painless, shorty lymph nodes and painless, it is syphilitic. Painful ulcer with lymphadenopathy, lymphogranuloma venereum, granuloma inguinal are its causative factors. Painful ulcer with bubo, chancroid, then in this particular case, chancroid is the causative factor. Now, lab diagnosis. Here I want to emphasize you that there are several investigations you can think of, including RPR, syphilitic HIV, dark ground illumination test if it is present. If the facilities are available, microbiologists show a beautiful treponema rotating. So it is wonderful. I have seen several cases of treponema. Nucleic acid testing are done. Here, important point is a treatment part. If you are suspecting herpes, then you have to give acyclovir for a pretty long time. 7 days is the minimum duration. But if the lesions are not subsided, you can increase the dose. Syphilitic benzathine penicillin is a drug of choice. No option about it. But if it is not there, azithromycin can be given along with ciprofloxacin for period of 3 days to 7 days. Continue treatment till the lesion heals. That is important. And treatment partners and other clients must be treated and advised for revisit of the case. Vaginal discharge is very common situation. Most of the causative factors are gonorrhea, chlamydia, trichomonas, herpes, candida, bacterial vaginosis is a common condition. Here, history of contact may be present, may not be present, discharge, burning, itching, backache, all these things you can come know. If you see the meatus, if it is red, swollen, and pus coming out, it is mostly gonococcal in female as well as male both. Lab diagnosis, wet smear for trichomoniasis is very easy to demonstrate. 10% KOH preparation if a patient is a diabetic. Try for candida demonstration. Smear, if pap smear showing clue cells, this is a basic indication of bacterial vaginosis. Optional test, HPV is nowadays very frequently being advised, HIV, RPR. So these are all the tests to be carried out for confirmation at a later stage, but treatment should be started from day one. Treatment, husband and wife and sex partner, important. Most of the time, if it is gonorrhea, suffixing 400 milligrams single dose is suffice with along with azithromycin 1 gram single dose. If there is no relief, 7 days treatment to be continued. If you are thinking in terms of trichomonas being demonstrated, secnidazole 2 grams single dose or tinidazole 500 milligram for 5 days. Fluconazole is a drug of choice in cases of candida infection, but it takes long time. Follow-up and possible reinfection is a possibility, and treatment failure also there. Most important, most in gynec practice, you get PID cases, pelvic inflammatory disease. The conditions are almost same like this particular bacterial vaginosis. So in this, the bacteria is almost same. The pattern of working is also same. But here, if it is a long-standing case, the patient may get PID and is a serious matter. Here, you have to continue treatment for a little bit more time, regular follow-ups. And if you find there is no relief, then you have to review the case, hospitalize, and treat accordingly. So complication in women, what are the basic complications it can create is pelvic inflammatory infertility, subfertility. You are regularly facing these cases. Ectopic pregnancy, if tube are blocked, partially blocked, ectopics are very notorious problem. Spontaneous abortions, stillbirth, low birth weight babies, increased susceptibility to opportunistic infections, cervical cancer, very serious matter, and chronic pelvic pain. So these are the possible complications we come across in a women. Criteria for selection of drug. This is very effective drugs. 95% are curative. Low cost, very economical in comparison to the complication. Acceptable toxicity, they are well tolerated by the patient. Organism resistance is unlikely to develop if they take properly. Single dose therapy, oral administration, no injectables are mainly required, and no contraindication in pregnancy and lactation, which is the important tool for all of you. So this session highlights are like this, that facts and impacts about the RTI and STI globally, we can understand. Scientific a proven approach with flow charts to treat RTI, STI. Flowcharts for clinical diagnosis with lab test as a supportive aid, along with education and counseling to the patient and the partner. Primarily complete treatment of curative STI during their first visit. Untreated missed case can lead to the risk of eightfold rise in HIV transmission, which is a serious matter for anybody's lifetime. So syndromic approach is really a successful way, and anybody can plan in their setups. So take home message is very simple. The gist of the same project is scientifically and proven approach is there. Does not deny the use of, I don't deny the test, that lab tests are useless. Yes, they are definitely useful, but don't wait for the treatment to be started on the day one. Correct and complete treatment for all common organisms responsible for particular syndrome. Syndromic management goes beyond pharmaceutical treatment to include client education and counseling. Here is a very important. Most of our doctors are now having a counselors in our setups. So counselors can really give a good aid to them, because we don't have that much time to discuss the issue. And that is why I initially, nowadays I'm thinking that I must learn psychology also with Dr. Jaria. The clinical skills of the doctor are well utilized. You are now really a doctor. The drugs used in the syndromic management are based on side effect, and in this particular treatment of the index client, treatment of the partner, risk reduction suggested by use of physical contraceptive barriers, client education counseling, and referral if necessary. So adopt syndromic approach to treat the RTI and STI successfully, gynae and obstetric cases, in the gynae and obstetric cases, and prevent them risk of 8 to 10 for 8 to 9 fold high chances of HIV spread. Thank you very much.
Thank you, sir.
Oh,
For such a nice presentation.
okay.
I'm still muted or what? Yeah. If there are
Pardon.
any queries, yeah, we can take the queries one by one. Huh? But there is one question we have received from Dr. Raghavan, sir. Yeah, good to see Kiran ma'am. Kiran madam, good evening. Madam is joined from Faridabad. Dr. Baba Saheb Munde, a dear friend from Pune. Hello, Dr. Satpathy. Nivedita Satpathy, hi, welcome. Huh. So there is one question from Dr. Gunjan Bhatnagar. She's asking, please tell us about the treatment for the recurrent fungal infections.
Pardon. Fungal infection.
Yeah.
Mostly, may I audible to you?
Yes, you're audible, sir.
Hello.
Yes,
May I
you're
audible?
audible, sir. You're audible, sir.
Right. Fungal infections are very common in diabetics. If a patient coming to you is a diabetic and uncontrolled diabetes, first and foremost thing you think of candida, or they are very easy to demonstrate in pap smear. We do special stains for making a confirmed diagnosis, or even then, if it is a curdy discharge, thick white curdy discharge, you are getting a case of candida infections. Many other infections are there, but in those the general resistance of the patient is poor. Then you can think another asparagus and others, but in commonly you find candida infections. And fluconazole is very effective, either vaginal route plus orally also.
So we are usually giving the fluconazole oral preparations, and of course the blood sugar level should be checked. Yeah, that's
Yes.
correct. And doctor, we have to give the proper course and explain the patient everything. These days also we are seeing a lot of patients with the recurrent fungal infections. So some effect of the lifestyle also. The girls are coming to me with the recurrent fungal infection. Once I take the history, the smoking, alcohol, that is daily in that. So we have to explain them that they have to reduce or cut off that also. If we tell them to
Very
stop,
correct.
they will argue, ma'am, that is not possible. So at least they have to reduce for that. Yeah, Dr. Munde, you can ask your question. Yeah, hi. You can unmute and ask your question. Sahitip, please permit it.
Yes,
Yeah,
yes.
yeah,
Thank you very much, madam, for allowing me to put my questions.
Good
Firstly,
evening.
I will thank you, Dr. Sharad Jain sir,
Thank
because
you.
you have illustrated in a very short time a big topic. And I want to know is the dose of that drugs you have prescribed, azithromycin and secnidazole, 2 gram. What is the duration for that doses?
See, actually, if you are suspecting if there is a meatal discharge, red meatus is there, you are suspecting gonococci or such type of thing. So initially, a single dose therapy, secnidazole 2 grams, if you are suspecting the trichomonal infection, single dose, but in that you have to give along with the secnidazole the antiemetic as well as antacid. Otherwise, patient will not come to you and he will abuse you. She started vomiting so badly. So 2 grams is a heavy dose, but single dose is to be given for effect.
Yes.
Otherwise, metronidazole is given, but that takes time. Right.
Very
Sir,
nice. Very nice. One somebody has asked recurrent fungal infections, including treatment. We have to change some lifestyle also, and the areas where we get fungal infections is the genitals and inguinal region only. Most of the times, what I will suggest is you should keep that area cool, clean, and dry.
correct.
It is very, very necessary. That is CCD. Keep cool, keep clean, keep dry. And
Good.
for that,
Clean, cool, and dry. Yeah, good. Yeah.
yes, clean, cool, and dry. And for
Yeah.
that, you can take care of your garments. They should be of 100% cotton, not of synthetic. And as far as possible,
Very true.
you should not use synthetic material or
Nowadays,
even mixed. If you are afraid of the fungal infection, you have to take care and you have to avoid the synthetic material, whatever and wherever is there, because it causes sweating, and prolonged sweating may lead to grow the germs in that area, and it will happen recurrently. Second, you have to clean all the clothes. Simultaneously, you are giving treatment, but all the garments you have to clean very strictly. You have to boil the garments actually and dry in a very hot sunlight.
Very true. Very true.
There are
They
so
should
many
not be.
conditions I have not covered in this particular because of the short of time.
Yes,
Yeah.
yes.
But
It is the question
scabies
of
is very common, pubic
it
lice
is
is
on
very common. So all these,
Yeah.
yes,
Yeah.
it is
they are
a
also a
timely
part of
question. It was not
STI.
planned. It was not a plan. It is not a part of presentation. It is not the part of the topic today. But somebody has asked, so I am illustrating the experience what I have gone through. So many patients we have treated like, and they are happy. So garment should be very dry.
Yeah.
It should not be humid. So
Yes,
and
Dr.
you have to use 3. Suppose whatever the garment you have wear in inner wear you have wear today, you should not wear it tomorrow. It should be wear day after tomorrow. So 3 innerwear should be there, and today's garment will be used after 2 days, not on next day, so that it will dry in good condition, and it will not be moist or humid, and it will not give you the recurrent infection of fungus. That
Correct,
is,
very correct, very correct. As you have mentioned all the things, Dr. Munde, yes, of course, the cotton undergarments and tight underpants, because these days the young girls are coming to me with very tight clothing they are using. And of course, that are also of the synthetic one. And we have also seen that there are in Pune, so of course, we are seeing the climate is changing daily. Sometimes, yes, it's very hot and it's raining also. And if the clothes
and
are wet, they are not changing the clothes also. So that also germinates for the spores. So that is also very important. So thank you for enlightening.
again,
So
you
yeah,
have to use the garments of 20 centimeters size more. If your waist is 80, you have to use 100. If you are 100, you have to use 120.
that's correct. But no, none of the youngsters will be going to listen on this.
They are
The,
then they are
these the
then they-
fashion of the tight undergarments, tight, everything tight fittings. They are coming to us, especially in the Korego Park. I'm seeing the girls, youngsters are coming with that only. Yeah. Good.
everything tight is causing so many problems, madam. If you
True,
are
true.
observing, you can keep an eye. The tight bras are giving rise to the lesions in the breast also.
Very true. Very true. Very
So
true.
you are, as a pioneer, as a expert in this field, you should encourage the community, whoever is coming to you. At least we
Of
cannot
course, of course.
talk to everybody, but at least somebody who is coming to us, we can guide and counsel them what should be done, and that will be the service to the society. Thank you, madam. Thank you very much, Sarath sir. It was very nice presentation and including
One thing
all the
I'll
things in
suggest,
very short time.
all this thing has to be taught to the basically filmmakers. Filmmakers make a type of clothes to their heroines, then the things can be solved, otherwise not.
Sir, here everybody is to do their business, and they will pack up the material in a new bottle. The material is always old, but it is shiny, it is lusty. So we cannot talk to anybody, but we can definitely counsel our patient. We can definitely behave ourselves and treat and teach the patients what and what should be done, what care should be taken, and what medications you should take, and what the hygiene you should keep. That is the only limit in our hand.
Yeah, correct, correct. Sir, we have received some very nice comments. Dr. Ugen Dorji has joined all the way from Bhutan. Thank you, Dr. Dorji, for joining. Dr. Dorji is one of the very active member of my group. He always tell me, ma'am, please keep on doing the webinars. So yes, he's giving the comment. Wonderful presentation, sir. Thank you so much. And besides this, he has written a comment. Thank you, Dr. Ritu, for coordinating wonderful wisdom online class. Hopefully in future too, madam. Yes, sure, sure. As if there is no positive the time, definitely I will try to do in a week 1 or 2 sessions. So stay tuned and stay connected. I will keep on posting. So I am able to see
Madam,
Dr.
ma-
Madan Kamble has also joined. 1 minute, 1 minute. Welcome. Dr. Poonam Gupta has joined all the way from Varanasi. Welcome, welcome. And Kanchan Balaji has joined from Kanpur. Hi, Dr. Poonam. How are you? Huh. So there is one more question from Dr. Nivedita Satpathy. Sir, her question is, should fluconazole can be given continuously for 7 days?
Normally, it is not so, because it is a toxic drug and it is going to affect the liver also. So it depends upon the situation wise. Normally, 3 times a week is suffice for giving a good response. Thrice a week, 1 day alternate. Or sometimes the condition is not that good, you can give definitely, but considering the SGPT, liver function test of
True,
that patient. No? Otherwise,
true.
this is a toxic drug and it may create other problems.
Yeah, Dr. Mundi, you want to say something now?
Yes, madam. Actually, fluconazole should be given once a week, 150 milligrams
Ideally.
once a week, ideally. And if the condition is
I tell
very
you, one thing is there, if you give once a week, patient will not get a recovery best and he will go to another consultant. And,
yes, but
and
this is
with
the
one tablet, these symptoms will be almost 50% gone. And then he will say, there is no infection. Unnecessarily,
yes,
doctor has given you treatment.
that is the problem of good doctor, sir.
Anyway, it is not the matter
Again,
of to be discussed here.
I
yes,
agreed to both of you, Dr. Munde also and Sharad Jain sir also. Yes, sometimes we have to increase the dose if the lesion is very vast and if the patient is coming for the resistant treatment. Sometimes I had also given thrice a week. The results come good. Acha, Dr. Madan
one more. I want to know,
Yeah,
madam.
yeah.
Whenever there is any webinar or seminar is there, you are asking for the registrations, and I think the people are not. Most of the people are not willing to do that lengthy procedure. What I care, what is the motto of that registration and putting the mails and area and mobile numbers also? If it is
That
not necessary,
Sahiti can answer because this for this platform I'm getting the for this program I'm getting the platform from the Shield Pharma, so that Sahiti or Chitrakala can better answer. I have no opinion for no objection for that also, because my program already get the lot of audience, so nothing like that ki I need all details. That Chitrakala can answer why they are needing for this registration and all that. Chitra,
yes.
can
Yes,
you?
So
ma'am.
there should be just Zoom and link. We should click and join the session. That will
Uh,
be the best option. And so many people there. So
yes,
many
sir.
people are not interested in registering. I think so.
Sure.
I have no problem,
So,
but some people may.
Chitra, see if it is possible, please do the some changes, so that will be great.
ma'am, actually, a company policy is like we need to do the registration because since it is contains sensitive contents, like medical related contents.
Okay.
If it is for patients, definitely we can do in that way. Since it
Acha,
is
okay.
for doctors, we are doing
Yeah.
it in this way, ma'am.
Acha, okay, no problem. I have no objection because Shield Pharma without asking me any question, and Chitrikala without asking me any question, whenever I require the platform, they definitely give. So, Dr. Munde,
One,
sorry for that because they are always cooperative for me. You also know this program is going from last 3 years. तो उन्होंने कभी भी शील फार्मा ने मुझे ऑब्जेक्शन नहीं किया कि मैम आपको प्लेटफॉर्म नहीं देंगे. Always they are ready to give. So,
Ritu, one suggestion to you,
yes,
if
yes,
you
yes, sir.
don't mind.
Yeah.
There are several pitfalls during blood transfusion to the gynecologist. We are regularly come across the requisitions, and we feel panic in that issue because you are expertise in your field, but transfusion field is completely changed, and this is regularly changing. So if
Okay.
your platform agrees and if you feel like give adequate time, then we can make a session on transfusion, myths about the blood transfusion
Sure,
and
sir.
what is
Sure.
the facts about it. We can
Sure.
plan. You
Yes,
decide
yes.
accordingly. I'm
Yes,
ready.
sure.
Okay.
Thank you so
And
much.
that
Thank
will
you.
be very wonderful session for everybody. I'm
That's great.
sure you will you will feel happy in that session, and
Thank
we can discuss interactions also, right?
thank you so much, sir. Definitely I will plan. I
About
feel always happy when
erythromycin
when
1
I
gram
get the chance
dose.
for the knowledge sharing. Huh?
No.
So yes, now there is another question from Dr.
Dr.
Nivedita.
Nivedita has given a
Dr.
question
Nivedita, you
here.
can unmute yourself and ask
Yes,
the question.
please
We are ready.
elaborate about the
Huh.
erythromycin 1 gram dose. Right. So here I want to tell you, Dr. Nivedita, what is your diagnosis? Azithromycin and your cefixime is a very good combination for gonococcal, right? Secnidazole is for trichomoniasis. There is a different issues. And If you are unable to diagnose these two things together in a primary center, or if you see that patient is poor, he may come, she may not come, so you can give these three drugs at a time. But clear करिए कि one day night you have to give azithromycin and cefixime. The day 2 grams of secnidazole along with perinorm or any antiemetic along with a good antacid. 3 drug combination on day 2. Then your purpose is solved completely. Right? Agree?
Yes, yes,
You have
sir.
any question, doubt about it?
Sir, there is one more question we can say. Just a second. I think from Dr. Raghavan sir only. Raghavan sir has joined all the way from Trichy.
Right?
He is asking, in the absence of what partner, not cooperative, what is the solution?
See, we are professional doctors. Sometimes we get irritated if the patient is not understanding and again creating problems. But a good counselor, if you have, he coolly listens to the person and he makes the person comfortable and confident to accept his suggestion. So counselor role is absolutely fundamental. I am feeling very bad. Sometimes I get irritated. He comes next day morning. Doctor साहब कुछ नहीं हुआ. I am very much upset. My symptoms are not at all relieved. What are you doing? So you get hurt in that. But if you have a counselor, that is why I told you that psychology, one should learn how to behave with the patient, because he is in panic situation. He is in trouble. So he can talk any absurd thing. But we are not in trouble. Right.
Correct, sir. Thank you so much. I think there are no more questions, then we can wind up because the program time is from 9 to 9:30. It's already 10.
Right.
So thank you, friends, for joining all across the geography. So stay tuned for the more sessions. Don't forget to join on the 16th October, 9 p.m. We are going to discuss and deal with the unexplained infertility, how to deal with. So what are the new things are coming for that, for the unexplained infertility? So we are going to discuss about that. Thank you, Dr. Intisar Murad, for joining. Yes, Dr. Munde, with your comment, we can wind up. Yes, you have raised the hand. Yes, I have seen. Yeah.
To the same point, I was having some network issue and I was out of the Zoom. So I have to register again and then join. Meanwhile, whatever the contents given or the reasons.
Not getting you?
Sir, you can join with the link which you have got in your email. Once registered, you will get a link in your email ID. You can join in the same link. You don't want to register once again, sir.
No, I want to know if it is very important, then you can do it. But what is the reason behind? Because it is very hectic.
Dr. Munde, they are giving the platform itself for the one session.
Face the problem.
They are cooperating, but let's we also cooperate. Leave now.
No, I am not.
3 weeks.
I have no question of the cooperating and uncooperating. Just now I have some network issue. I come out of the Zoom and I have to re-register again. Then I have to search for the mail, go to the link and then click. It is very hectic and difficult.
Listen to Dr. Balasamande. The program is going live on my YouTube channel also. Those who are getting the difficulty of joining via this, they can go only directly on the YouTube. The program is going live there also. They are cooperating. We should also cooperate. Leave no problem. I agree to you and agree to him, her also. Chalo friends, with this we'll wind up. It's a very long day. It's
Thank you very much. Thank you very much.
Okay.
Madam, thank you very much.
Thank you, Ritu.
Thank you,
God
sir.
bless
Thank
you.
you so much.
God
Thank you
bless
so
you.
much, sir. Thank you. Sir, this is a certificate of appreciation for
Thank you.
contributing as a distinguished speaker for 10th. Sir, soon I will contact you for the blood transfusion. See.
Okay,
Thank you.
whenever you feel
Thank you
comfortable.
so much. Thank you so much, sir. Thank you.
Thank
Thank
you.
you. Thank you,
Bye.
dear friends. Dr. Nivedita, I have my name. You can go through the YouTube. You will get the detail of my channel. Okay. Bye-bye, everyone.